It's a typical day for this RCMP team. John Ablinas checks in on an at-risk person, while Constable Lori Kokala listens back in the car. They're partners, but with a twist. Ablinas is not an officer. He's a psychiatric nurse.
Try and help individuals right in the moment of their mental health needs or their mental health crisis.
Together, they form what's known as a police and crisis team, or PACT. In addition to wellness checks, they also respond to urgent crisis calls.
We'll get the extreme ones where they're actually screaming, or they have a knife, they're locked in the bathroom.
It's a job that's keeping them increasingly busy.
He's turning more vengeful as time goes on.
While we're out with the team, a concerned caregiver calls.
So these things are very, very serious. They're very real.
We'll pay him a visit and we'll try and figure out best course of action here, and we'll update you when we're done.
So, another home check.
You got anybody else here with you today?
I'm just watching a YouTube video.
Are you?
Sure.
Cool.
The young man is paranoid and anxious.
Last night you made a decision to hurt somebody.
I did, but...
How are you feeling about that today?
Well, to be honest...
Ablinas keeps him talking.
And just be honest with the suicide stuff too, right? If you start feeling like you're losing grips, you can call.
Today, no arrest, no trip to hospital, where traditionally many people in crisis end up after a call to police.
Police before, because they didn't have the mental health training or access to a professional beside them, 9 out of every 10 police calls would get apprehended and brought to hospital. Now I think we're down to probably 1 out of every 10, right?
The police and crisis team has seen results here in Red Deer, but some advocates say these types of teams aren't a perfect solution.
Police are sometimes excellent at de-escalating situations, but there is that possibility of use of force, including lethal force.
This advocate wants to see more funding to fix the root causes of addiction and mental health problems, to reduce the likelihood of those 911 calls.
1021.
Go ahead.
But in Red Deer, where those calls keep coming in, Kokala and Ablinas have seen a difference, building trust with those in crisis. Catherine Tunney, CBC News, Red Deer, Alberta.